Welcome to the Coming Clean podcast with your host, Peter O. Estevez.
Hit a dash in my position, you will never last. Real talk, I had to get it from the mall. Real talk, now I'm vibing with a bankroll. Cash.
Hello and welcome to a new episode of Coming Clean podcast. This is your host, Peter O. Estevez. Thank you for being here with us today. First of all, I want to invite you to go to my website at comingcleanpodcast.com and subscribe to be on the list to receive the first chapter of my upcoming book, From Lies to Riches, to be released really soon. Now today, we have an incredible guest, Dr. Shane Creado. Dr. Shane Creado is a double board certified brain health specialist. He's a sleep specialist, he's a sports psychiatrist, and he is an integrative psychiatrist. He has worked on treating sleep disorders, but also perfecting and optimizing sleep and boosting sports performance and workplace productivity. He is on the board. Hello, and welcome to a new episode of Coming Clean Podcast. This is your host, Peter O. Estevez. Thank you for being here today. First, I want to thank you for being part of our community each and every week. And secondly, I want to invite you to go and subscribe on my website, comingcleanpodcast.com, and subscribe to receive the first chapter of my upcoming book, From Lies to Riches. Hello and welcome to an episode of Coming Clean Podcast. This is your host, Peter O. Estevez. I am so excited to be here like I am each and every week, and I want to thank you for being part of our community. And I also want to invite you to go to my website, comingcleanpodcast.com, and get on the mailing list to receive the first chapter of my upcoming book, From Lies to Riches, to be released really soon. Please don't miss out. Get on that list immediately. Today's guest is Dr. Shane Creado. Dr. Creado is a team member at the Aitman's Clinics, and he is a double board certified brain health specialist, a sleep specialist, a sports psychiatrist, an integrative psychiatrist, and he works on treatments for sleep disorders, perfecting and optimizing sleep, and boosting sports performance and workplace productivity. He is also on the board of the International Society of Sports Psychiatry and works with NBA Players Association, PGA Tour Europe, and the Aitman Clinics as listed before. And I am very excited to have Dr. Creado with us today, because I want to touch on what's going on in the world today. There has been a plethora of increase in alcohol consumption, drug consumption, suicide, and much more. And what a better person than somebody with the credentials and the credibility of Dr. Creado to come and guide us on what to do in this process that we're living today, in this new normal. Hello, Dr. Creado. Thank you for joining us today. How are you?
Hi, Peter. Doing great. So excited to be here today. Thank you for having me.
I am very excited to have you. We are living in a world that there's a lot of change. There's a lot of turbulence. There's a lot of uncertainty. And we have seen a tremendous spike in suicide, in addiction, in abuse of alcohol, in drug addiction. There's a plethora of underlaid issues that are part of what's going on in society today that we don't talk about. And I wanted to have an opportunity to have an expert like yourself to come on and to guide us and tell us, how is it that we can transition these burdened times? So with that in mind, will you tell us a little bit about Aitman Clinics and about yourself?
Absolutely. So Aitman Clinics was founded by Dr. Daniel Aitman, who is an incredible psychiatrist and someone I'm so proud to call a mentor of mine. So the reason why he became such a pioneer in the field of mental health, and I'm sure most people listening to this have heard of him, read one of his books, I think he's published over 42 books and counting, is because he's so passionate about doing patients and the world right in terms of how we approach mental health. And the way he approaches mental health and the rest of us at Aitman Clinics approach mental health is it's not really mental health because there's such a negative connotation, there's such a bad stigma associated with it, but getting down to the root cause, which is brain health. And beyond that, body health. So the body supplies the brain with nutrition and everything it needs, and then the brain creates our version of reality, how we process information, how we interact with our loved ones, how we run our businesses. And so if we only throw medications at somebody without addressing root cause, in our opinion, that's really bad medicine or even malpractice. But the thing is, Peter, for so long now, over 60 years, psychiatry really hasn't changed. We have the same diagnoses, same medications. So at every level, it's really sad to say that the system is broken and it doesn't serve our patients the way they should be served, which is why Dr. Amen has become such a pioneer in this field. It wasn't easy for him. He got a lot of pushback when more and more evidence began to come along and say, well, look, clearly what we're doing isn't working, so we need to change the paradigm. And as we know, SSRIs or antidepressants like Zoloft and Prozac, they have an overall efficacy rate of 30 to 40%. So that's around the same as placebo effect. When we do studies, randomized controlled studies, you have a placebo or a fake medicine like a sugar pill and an actual medicine, two groups of people. Around 30% of the people with the sugar pill actually improve, no matter what you're measuring, whether it's anxiety, depression, blood pressure issues. That's the power of the human mind, of course. But then what exactly are these medications doing? Are they really bad medicines? Are they made wrong? Is the diagnosis wrong? Probably all of the above. So what Dr. Amen decided to do was, okay, we know the neurobiology, and I'll dive into that in a little bit. But we also need to look at the organ we are treating. Because otherwise, by listening to somebody and throwing a medication at them or saying, oh, you need some therapy, what kind of therapy, right? It's the same way Abraham Lincoln was treated 150 years ago for depression. That needs to change, and we've set a course to do that, and we've been extremely successful with our patients. We have a success rate of over 80% across the board, whether it's dementias, ADHD, depression, anxiety, psychosis, not because we're the greatest few psychiatrists on the planet, no, but because we really want to serve our patients well, to do due diligence and look at every underlying factor, leaving no stone unturned in terms of everything contributing to our patient's problem.
Now, you have described the brain as our command center.
Yeah.
And, a lot of us, or most of us, pay a lot of attention to our body. I work out on a regular basis. I do things that, I sleep, I do things like that, but it's never been consciously up until recently, up to, a few years ago when I came across Dr. Amen, that I started really following some of his advice and following some of what he describes brain health. And I really like that terminology. You have also known to say that if you keep your brain healthy, your reality is healthy.
Yes.
So what does that mean? How is that correlation between the brain and the and the reality? Can you explain that to us?
Okay. So what we're talking about is two different things, right? So the brain, if we think about brain health in terms of our hardware, and we think about our perspective and our thought processes, our stress management as our software, if you have a computer without a CPU or a chip, there's no way the best software is going to work on it. So we need to have our base healthy. We need to have our hardware in tip-top shape in order to run the software programs that we desire. Reality is a matter of perspective. Peter, in my opinion, my job is kind of easy. Most people come to me because their version of reality isn't working for them anymore, or it's changed and now it's not working for them. So what I'm supposed to do is help them along that journey at that point in their lives and use that as an inflection point. Not say, oh, well, look, you've been drinking alcohol for so many years. You're getting less sleep. Your sleep apnea is untreated. Your hormones are all over the place. You have really lousy friends, unhealthy habits. No, that's only 50% of the analysis, right? They'd probably run away. But it's like, okay, this is what you're doing right. This is what you can improve on. And we need to use this as an inflection point. This is our baseline measurement. A lot of us don't want to face those realities. We don't want to face the fact that we are bad at something over bad habit. God knows most of us would be terrified if someone had to look at our Google search history, for example. So that leads me to think about the shadow, what Carl Jung described, the part about our lives that we don't even want to face, that we don't want to acknowledge. And then how can we hope to really know ourselves if we don't even know all of ourselves, if we don't face that shadow? We're so afraid. We're so afraid of what we might find. But there's also a saying that says, often the treasure you seek is in the cave you are afraid to enter. So the first thing I tell my patients is, you can't possibly be aware of things out of your awareness. But through guidance, knowing that we're in this together, we're going to face your shadow because you've been running away from it too long. If you run away from your shadow, guess what? It's right there behind you, right? And the longer you run, the longer the day goes, the bigger your shadow gets, the more afraid you will be. So let's face your shadow, and let's not look at those things you don't like about yourself as, oh, I'm such a bad person, I'm a loser, I'm a failure for these things. But, oh, this is good feedback. This is not failure, this is feedback. This is a learning opportunity. Let me approach it like a child with an attitude of curiosity. You know, kids crawl around all over the place, put their finger in an electrical socket, get a little jolt, but they keep exploring. And that's what we need to do. That, in my opinion, is our purpose. Not just an overarching, oh, I want a great overall purpose, but a purpose in every moment. Like right now, you and me having this conversation, your listeners listening to us.
You brought up something that just resonated with me, and the fact that there's the factors that affect our brain health: alcohol, sleep, and relationships. Okay. Can you tell us how each of those, or what role each of those play in our brain health, and how do we correct those?
Okay. So with alcohol, it's really interesting because alcohol can help relax you, can help you fall asleep, but it's going to cause your brain to go through partial withdrawal, and so you'll wake up in the middle of the night. A lot of people who have alcohol at night wake up in the middle of the night, although they fall asleep properly. Alcohol works on the same brain receptors that Xanax and Klonopin and Valium act on. So if you're taking those medicines as well, it's pharmacological alcohol. Why is it bad? Well, it can worsen sleep apnea, which is directly related to dementia and brain damage. It can increase your risk of sleep fragmentation that I described, that can also lead to dementia and cancer and heart attacks and strokes. But alcohol, more importantly, can devastate certain brain areas, and we see that in the SPECT imaging all the time. So for the audience who are not familiar with SPECT, not many people are, it's single photon emission computed tomography. A fancy way of saying we measure blood flow and activity. So it's a little different, well, very different from CTs and MRIs. They just look at a picture of the brain. But we really look at how these different brain regions work through blood flow and activity. And so alcohol affects main centers that are responsible for frontal lobe functioning and temporal lobe function. What do the frontal lobes do? Attention, concentration, executive functioning, task organization, planning, multitasking, motivation, drive, social connectedness, rational thinking, suppressing impulses. They're run by dopamine, so you'll have a dopaminergic issue there too. Alcohol affects the sides of your brain, your temporal lobes, which are your memory centers. So they help you with emotional stability, new learnings, memory, language, and word finding.
And primarily by interrupting your sleep patterns in the middle of the night. This takes a greater impact aside from all the other harms that could potentially bring to your body. Now, two questions, doctor. One of them is, how is that any different from me getting up in the middle of the night to go use the bathroom to pee?
Yeah. Well, alcohol will also mess with your sleep rhythms. So your deep and your dream sleep will be dysregulated. So when you wake up to pee, it's very different from you waking up because your brain is going through partial alcohol withdrawal. So if your brain is constantly flooded with alcohol, even small amounts, relatively small amounts, it's so used to that level of alcohol that it reduces its sensitivity to alcohol. But then when the alcohol is out of your system, it goes through kind of like an alcohol deprivation or a mild withdrawal, which is why you wake up. You might feel anxious, you might feel jittery, you might need a drink now just to feel reasonable, which goes down the path of addiction, the tolerance, the withdrawal, the dependence. And those areas of the brain that are selectively damaged by alcohol use are the same areas that are damaged in head injuries, same areas that are damaged in sleep deprivation and sleep apnea. And obviously, that's going to lead to really bad downstream effects, what I call the cascade of catastrophe. Forget about the impact on diabetes, cholesterol issues, the liver damage, the kidney functioning. I mean, Slash, the guitarist from Guns N' Roses, he has an implanted defibrillator in case his heart gives out on him. It's going to shock him. It's implanted inside his chest because he used to drink a lot of alcohol back in the day. So these things have a whole host of effects, but not many people are aware of the specific impact of alcohol on the brain.
Now, let me ask you a question. How does relationships, which is something that you brought up in your list, affect your brain health? And what is a healthy relationship for your brain, and what is an unhealthy relationship for your brain?
That is a very important question, and one size doesn't fit all. But here are some concepts to keep in mind. A big social circle is not essentially the healthiest. We know that. I mean, drug dealers are big social circles, I'm sure. They're not exactly the healthiest. But what makes a healthy social connection or connections is finding meaning, finding purpose, whether it's church activities, whether it's doing the kind of work that you do to help people out without getting anything in return. That in itself is fulfilling. So that sense of self, that sense of purpose, that sense of contributing to the betterment of society is extremely rewarding. And studies have shown that when you have healthy interactions, whether it's your relationship, your marriage, your partner, or whether it's social relationships, whether it's relationships in the community, in your church, or a place of worship, what happens is your oxytocin levels increase. So your cuddle hormone, your dopamine levels increase, the feel-good hormone. In other words, it's a kind of a high for people because dopamine is the same neurotransmitter that's responsible for ADHD deficiency and is also the primary neurotransmitter that's boosted with cocaine and methamphetamine use. So dopamine, oxytocin, there have been studies to show that we have healthy social interactions, direct correlations with longevity, with heart health, with staving off dementia. And it makes a lot of sense. Not only are there benefits from healthy social interactions, but having less unhealthy social interactions, less toxic dynamics with certain people is going to lower your stress. It's going to lower your inflammation. And then there's a whole cascade of stress hormones like cortisol, which boost your blood sugar levels, worsen inflammation, boost your cholesterol levels, cause you to gain more weight. We all know what it feels like to stress eat. You're going to resort to either the substance of choice or sugar or carbohydrates. And more research shows that sugar is more addictive than cocaine.
So now let's talk about diet for your brain health, okay? What is the adequate, appropriate, and I realize that we all have a different footprint, we all have a different DNA, we all are created differently, but there's general terms of things that are healthy for all of us and for our brains. And you know, in my understanding is if you feed your body well, your brain nourishes as well. So what are some of the tips that you would recommend as far as healthy foods that we can intake in order to begin a process of reconstructing a healthy brain?
Okay. So again, no answer is simple, but we're not fans of fad diets. Those are not sustainable. They generally don't work. And different brain types can benefit from different diets. The first rule to remember is you need to know what you might be sensitive to. Now, food sensitivities are different from food allergies. Food sensitivities result in what could be simply described as mild inflammation. But food sensitivities can result in inflammatory mediators that cause certain areas of your brain to function less than ideally or suboptimally. How do you know that? Well, there's food sensitivity tests, which are not the most reliable. But what we do is an elimination diet. So you start eliminating one food at a time and look at monitor how successful you are in terms of brain fog, attention, memory, anxiety, irritability. Some people, well, most people, if you are sensitive to something, you're usually sensitive to dairy or carbs. Carbs get converted to sugar. So those are the big ones that I would say we need to avoid. Why is sugar and carbs so bad for the brain? Because they result in more inflammation, causing the frontal lobes to shut down, which is why we've had a nice carb-rich meal. We feel like relaxing and feel really sleepy because your frontal lobes help you with attention, motivation, drive, dopamine, energy levels, lower in function. So I never have a carb-rich meal for lunch between patients during work days. Absolutely not. It's going to make me really, really sleepy. Not only does the inflammation worsen, but what happens is your brain is swimming around in a lot of blood sugar because it's boosted with carbohydrates, but it can't utilize that. So your brain is essentially starving of nutrients surrounded by the blood sugar. And then your body says, oh, let's drive up some insulin to bring those levels down. But if you've had a big boost of sugar or carbohydrates, your body will overcorrect slightly. So your blood sugar levels will dip below normal. And then your body says, oh no, there's less blood sugar. Let's release some stress hormones like cortisol to boost those blood sugar levels up. And then again, your body may slightly overcorrect. You'll have more stress. You'll want to eat some more because you just had the sugar crash. That's what the sugar crash is all about. And so it causes big fluctuations in your mood, low energy, loss of productivity dramatically. So that is why sugars and carbs are really bad for anybody's brain. When it comes to people who are more emotionally vulnerable, tend to overreact to certain situations, one of the best diets I would suggest is the ketogenic diet. High fat, high protein, virtually no carbs and sugars. The ketogenic diet has been shown in studies to resolve seizures in around 60% of people because they help boost the temporal lobes, main region where seizures are located. But guess what? The temporal lobes also help you with mood stability. And in our experience, in our work with patients, we find the ketogenic diet is great for people who have really vulnerable mood swings. Now, the Mediterranean diet and the paleo diet are supposed to be extremely healthy. They're rich in omega-3s, low in omega-6s. They have really good all-around balanced nutrients. But guess what? The studies have basically compared the paleo diet, the Mediterranean diet, to the Western diet, which is the worst possible diet you could compare any diet to. So depending on someone's brain type, when we look at the scans and their symptoms as well, we can tailor a good health plan. And there are certain foods to choose and certain foods to lose. Anything that can cause more inflammation, anything that can shut down your frontal lobes like sugars and carbs, anything you're sensitive to would be the first things to avoid. Now, some people want to go all vegan, all vegetarian, and I don't think that's a good idea. If it's a religious issue, of course I respect that. But more studies have compared vegetarians and omnivores and found that vegetarians have around 30% less omega-3 fatty acids than omnivores. And vegans even less so. Also, if you're a vegetarian, you're going to lose out on iron. And iron is needed to make dopamine in your brain. It's needed for red blood cell functioning, for oxygen delivery to your brain. You're going to be low on zinc. Zinc is needed for your brain to make serotonin and adrenaline. You're going to be low in other important B vitamins as well that can cause big problems in terms of your brain health. So any patient who comes to me and it's not a religious issue, I need them to eat their meat.
Doctor, let's talk about the current state of affairs in the world. You know, the fabric of our society is in true pain, and there's only a stronghold of people that, for whatever reason, have been able to continue and continue to live and live well without being deeply affected by fake news and by the things that are going on around the world. Now, this is not new that things like this happen around the world. Throughout history, there's change and evolution and danger and unfortunate circumstances that take a deep and profound effect on our societies. And it always seems to be a tremendous amount of society that greatly gets impacted. And unfortunately, we can look at different cultures, but it's typically impacted by economic demographics. So if we talk to that segment of the audience, what do you recommend for them today? You know, that segment of the population is deeply affected by suicide, is deeply affected by alcoholism, drug abuse, spousal abuse, a lot of dysfunction that becomes very chaotic, and it starts in the brain. It starts on how people feel, okay? So can you kindly walk us through how you see that and how we can support that community into coming together and finding some stability during these difficult times?
Absolutely. That's such a good point to bring up, Peter, because most people don't have access to the best healthcare. And how do we even define that? It's not often the most expensive. So what I'd say is, first, work on improving yourself. You can't hope to affect change in your communities, in your family, in politics, or the world if you cannot focus on yourself. So you know what they say on airplanes, put a mask on your face before you help the person next to you, even if it's your kid who can't put a mask on themselves. So let's focus on starting that conversation. And this is a great launching point. Talk about it. Talk about your brain health. Yes, your feelings are important. But what are we going to do about it? What change, what positive change can we affect? Are these actions helping or harming? Are these thoughts helping or harming? If you have a stated goal of bettering your community, what are you doing to lead by example? Well, you could either cause some damage and hurt people, or you could get similar-minded people together, start those conversations, lobby for change, run for office. On a very small scale in your community, neighborhood watches. Look at the kids. What are they doing? Are they growing up in single parent homes? And that's a big one, because what are those kids going to do? They're raised by their mom, they go to school, then they want to go out and go for a walk on the street with their friend. They want external validation. They seek that with other peers, maybe older boys, maybe people who are getting quick money on the side through dealing drugs. And then that cycle perpetuates. And it's kind of like a desensitization where first it's like, okay, using weed and then selling weed and then branching off to more and more things. And they're more and more desensitized, and then they go so far that that's the way of life for them. And they don't know any different. So engage in your communities. Look at healthy outlets. Instead of walking on the streets and getting into bad company, start a kickball league. It doesn't matter what you do as long as it's healthy. Using exercise as play. Have those conversations. Listen to helpful podcasts like this. Those are free. Those are free resources for them. Exercise is key. Doing your homework, focusing on the processes, not the outcomes. So what do we do for brain health if you can't afford an evaluation in AME clinics? Well, you could eat right, minimize processed foods, minimize sugar and carbs, minimize fast food consumption, exercise every single day, meditate, tons of free apps, make sure your sleep cycles are well regulated. Those are the foundations of brain health. If you're eating right, sleeping well, exercising and meditating, you've done over 80% of the work. And then build on that.
You're a sleep expert, as a matter of fact. I mean, that is your specialty. So let's talk a little bit deeper into the importance of sleep and what is a good sleep pattern. Is it the same for everybody? Do we all need the commonly known 8 hours sleep, or does that vary?
It does vary greatly. So sleeping is something we all do. We cannot survive for prolonged amounts of time without sleep. We can without food, but not without sleep. And one size doesn't fit all. Each one's brain needs different amounts of sleep. Some people say, oh, I'm great with 4 or 5 hours of sleep. I'm really high functioning. Maybe 1 out of 100 people are short sleepers. But the vast majority of us need different amounts of sleep. When you are a kid, you need maybe 12 to 16 hours of sleep. As a teenager, you may need 10 to 12 hours of sleep. And as an adult, you may need between 7 to 9 hours of sleep most commonly. A few basic rules to understand is that if your brain needs 9 hours of sleep a night, but you're getting 7 hours of sleep a night and you think that's great, every week you're losing out on 14 hours of sleep. Well, you might think this is not a big deal, but there's direct correlations with obesity, heart disease, strokes, diabetes, psychiatric illnesses, every kind of psychiatric illness, hormone dysfunction. Guys have testosterone levels equivalent to someone 10 years older than them if you're getting less than 6 hours of sleep a night. Direct correlations with dementia. Over 300 genes contributing to inflammation are overactive, so more inflammation. Over 300 genes helping with your immunity don't function well enough, so more susceptibility to illnesses like COVID-19. Your lifespan shortens, increased risk of prostate, breast, colon cancer. In fact, the WHO has designated shift work disorder as a probable carcinogen, and shortening of the end caps of your DNA, which leads to an increased risk of death and cancer. So that's what chronic sleep loss can do to you, let alone the direct impact on the brain health that we mentioned in terms of concentration, memory consolidation, let alone the work performance. Already in this country alone, around $200 billion a year on lost revenue because of work performance impairments. And I'm a big fan of strategic napping. I can tell you what that is in a little bit as well, which is why some big organizations have sleep pods, sleep rooms as well. So what do you know? How do you do it? Well, if you're on vacation, or unfortunately if you've been laid off, use that as an opportunity to see how many hours of sleep you need in order to wake up feeling refreshed and function well throughout the day. If you're catching up on the weekends, that means you're not allowing yourself enough sleep on the weeknights.
And I'm going to interrupt you right there. Can we actually catch up on our sleep? If I sleep if I'm traveling or doing whatever, and I'm only sleeping 5 hours a day, and then I want to make up my lost time, can I make it up by sleeping all day on a Saturday or Sunday? Is it physically and mentally healthy for me to do that?
In a way. So if you are staying in bed longer on the weekends, then you're going to waking up super early during the weekdays, waking up much later on the weekends. You're actually forcing your own brain into jet lag mode. You're actually inducing shift work in your brain, which is going to lead to that cascade of inflammation and heart disease and all that stuff, dementia risk. But if you are fixing your wake up time all days of the week, and if you are traveling, that's what I work with my elite athletes on and my CEOs or frequent travelers. How do I strategically help them nap? So if you had a really, really busy week, on that Saturday, keep your wake up time fixed, maybe 6 a.m. But you know that you were losing out on maybe 30 minutes of sleep every night, and so now you've lost out on 4.5 hours of sleep. Don't sleep in bed that morning, but maybe at 12 p.m. or so, get a nap, a fixed nap, fixed time, fixed duration, because then you're catching up on that sleep thirst without really sabotaging your sleep cycles. So it's all about synchronizing. And I always tell my athletes as well, if you're getting, of course, you want to celebrate, party all night, I respect that, I get it. And I'm not going to be a sleep Nazi, but try and keep those fixed sleep cycles, getting your daily requirement in a 24-hour period, at least 4 nights of the week. If you're traveling, I work with my athletes a month before they travel. I know their schedule about what mode of transportation, how to travel, what time to travel. And then using that strategic nap at a fixed time in the afternoon will allow you to make up for that sleep thirst without disrupting your rhythms.
And I want to emphasize that Dr. Creado is a specialist and works directly with the NBA Players Association and with the PGA Tour in Europe. So I want to emphasize when you reference athletes, that's what you're meaning.
Yes. Sleep is the pillar of performance, whether it's athletic performance or work performance. And Peter, if companies knew the impact of sleep on their employee performance, for example, NASA did a study and it allowed their pilots a 26-minute nap. Their productivity, their wakefulness improved by 34 to 54%. Imagine how beneficial that could be. So working less, but much better, more efficiently, the bottom line would improve. You could go back to your wife and kids and dissociate from work. So better relationships, better sleep because your brain isn't in go mode late into the night. Less absenteeism from work, less workplace injuries because if you're sleep deprived, you're functioning essentially drunk. It's going to improve the bottom line of companies by hundreds of billions of dollars every year, but also overall healthcare expenditures. And we think about the most common causes of death in this country: heart disease, traffic accidents, cancer, diabetes, dementia, with direct correlations with sleep. So imagine the total cost burden to this country alone, let alone the world, and what we can do about it. And the beautiful thing is that sleep is modifiable, Peter. This is easy. If you know what you're doing, you can weaponize your sleep.
Yeah, absolutely. And it's free. I mean, it's something within us, something that we have control, complete control over it. Let me emphasize something and correct me if I'm wrong. Drunk sleep or sleep drunk, what is the word? Is equivalent to actually being inebriated or have drank alcohol. Is that correct? If you're sleep deprived.
That is correct. In fact, when I work with my patients who are chronically sleep deprived, they don't even think it's an issue. But when I say, okay, let's work on extending your sleep by 30 minutes every night, or Stanford did a study on their athletes, and they found that a 30-minute sleep extension could boost their reaction times, their sprint times, their swimming times by over 17% getting off the starting block. That's massive. That is massive in the world of sports, but also everyday life. So yes, essentially, your brain functions drunk. The same areas of the brain are affected. I always tell my patients, well, you're basically causing yourself to have a teenage brain. You know, super emotional. Well, nothing against teenagers. We've all been through those phases, but you know your emotions are all over the place. You know that it's really hard for you to think rationally because your rational brain, the frontal lobe's developing in your late 20s, early 30s. So their emotional brains are fully developed, their rational brain is shut down. Same thing with alcohol. And interestingly, most of the fatal traffic accidents in this country, over 6,400 fatal accidents in this country every year alone, most of them are related to drowsy driving. Let me put that in perspective for you. So if you're nodding off and then, okay, you're awake, by the time it takes your brain to nod, it's 3 to 5 seconds. And if you're driving at 65 miles an hour, every second you're driving 95 feet. And by the time it takes you to nod, you're essentially driving to sleep over 300 feet. Wow. That's the difference between life and death. Your reaction times will reduce. There was a really cool study, Peter, that looked at how sleep deprived you need to be and they compared it with the number of alcoholic beverages one consumed. I don't know why they did such a study, but it was very useful in understanding the direct effects in terms of functioning. So 6 hours of sleep is equivalent to having 2 or 3 alcoholic beverages in terms of functioning, reaction times, productivity, emotional reactivity.
Wow.
4 hours of sleep is equivalent to 5 to 7 alcoholic beverages. And it goes on. So can you imagine what's happening to us without even knowing it if we're just losing out on 1 hour of sleep every night?
Absolutely. Let me touch on one area that, as you know, is dear to my heart, being sober 20 plus years, in recovery for 20 plus years. The correlation of our brain being stunted at the age that we start abusing alcohol or drugs. So, you know, if an individual starts abusing alcohol or drugs at the age of 13 years old, you know, our brain stops growing. Is that correct? At that age? Okay. How do we catch up if we catch up if we get sober, and how and what is the best ways to enhance, improve our brain health?
Okay. I always say it's never too late. When my patients come to me and we look at their brain scans, it's not, oh no, this is the end of the road. It's, no, great, this is our baseline. That's what any good physician or good engineer does, right? They assess a baseline, get a measurement, intervene, and track over time. So that's what we're doing here. No matter how bad it is, unless it's the point of no return with severe dementia, we can pull things back. Because the hippocampus in the temporal lobes, which are our memory centers, generate around 700 new brain cells every day. And those brain cells are little baby cells we need to nurture and love and protect. So Dr. Amen says 3 things. You need to love your brain. You need to know what to do. You need to know what not to do. So that's the way we approach it. You can always try and heal your brain as much as possible. We do that through getting some baseline measurements to look at hormonal imbalances, vitamin deficiencies, nutrient deficiencies, gut health, because your gut produces 75% of your neurotransmitters, optimizing sleep, both the quantity and the quality, like treating sleep apnea or restless leg syndrome, regular exercise, sleep, meditation, super important for the brain health. And again, I want to quantify things rather than saying it's good for you, because people know it's good for us. But when you put it in perspective, then it, in my opinion, it's much better. So exercise. What is exercise? It needs to be a prescription. The simplest exercise to do that you know you're going to have benefit from is at least 30 minutes of moderate intensity exercise most days of the week. Moderate, well, it could mean even walking as if you're running late. Get that heart rate up. And what's that exercise going to do? Blood flow to the brain. It's going to improve your endorphins, your serotonin, dopamine. There were studies that compared maximum doses of Zoloft to this exercise. Equal benefit in people within 6 weeks. More benefit in the exercise group than Zoloft in the long term. Meditation is useful, extremely useful, because it actually boosts the blood flow and oxygenation to those parts of the brain, the frontal lobes and the temporal lobes. Harvard Medical School did a study in 2018, people in their 50s, and had them meditate 27 minutes a day over 8 weeks. And then 8 weeks later, they imaged their brains again, and they found they had as much gray matter in those important areas as 25-year-olds. And exercise improves BDNF, which improves the size of the hippocampus and the temporal lobes. So we know we can heal the brain. Hyperbaric oxygen therapy. That's been a huge hit with a lot of my patients, my athletes, people who had injuries. Justin Bieber loved it. He bought his own one immediately when we worked with him, because it boosts oxygenation to the brain and helps your brain heal.
What is it that up until recently, and primarily driven by Dr. Amen in the clinics, in the Amen clinics, why is it that we didn't have conversations like this before? Why was the brain such a mystery?
Okay. Unfortunately, it goes way back to us diagnosing people in psychiatry based on clusters of symptoms. So, for example, if I have to use the DSM, which is our diagnostic Bible, to say that someone has a major depressive disorder, they have to meet certain clinical criteria. For example, low energy, lack of interest, loss of pleasure, negative thinking, guilt, shame, self-doubt, sleep and appetite disruptions, negative thought cycles. All right, so those are the symptoms. And if someone meets some of those criteria, we say, congratulations, you have a diagnosis of major depressive disorder. But each of those symptoms has different brain regions that are involved. That's why we look at the neurobiology. The frontal lobes help you if they're not functioning properly, you'll have the low energy, loss of interest, loss of pleasure. If your deep limbic system is not working properly, there's more negativity, guilt, shame, self-doubt. If your hypothalamus is not working properly, that contributes to the sleep and appetite disruptions. And if your anterior cingulate gyrus, or your brain's gear shifter, is working overtime, you're going to get stuck in those negative thought cycles. So with all these different brain regions implicated, how is a pharma company, and I'm not shitting on pharma companies either, how are they expected to make a medicine to target certain brain regions when there's all this mishmash of brain regions contributing to it? Of course they want FDA approval, but the medicine is not addressing specific brain regions. Certain medicines can act more on a certain brain region than another, and that's what we do. We don't rule out medicines, but we target our approaches based on underlying factors. And then those criteria that I mentioned to you, there's always a criterion that says, okay, these symptoms need to be met in the absence of a general medical condition, substance use, or withdrawal. Now, Peter, if any of our listeners have ever been to a psychiatrist, how many psychiatrists look for the general medical conditions like hormonal imbalances, vitamin D deficiency, gut microbiome, toxin exposures, mold, lead, all those factors? I mean, I didn't learn that when I did my medical school and my training, and I trained in one of the best training programs in the country. That's what we do differently. We do our due diligence. Otherwise, if you just throw medicine at someone, it's like putting jet fuel in a broken down car. Your gearbox isn't working. What's that going to do? What's the jet fuel going to do for you?
So the reality is that the clinics are treating our brain as a command center, period.
Exactly.
Dynastically looking at every area of our brains in order for us to perform our best at all times.
Yes, we approach brain health the way that heart health has now begun to be approached. So if God forbid somebody has a heart attack and they're asking the doctor when they're being discharged, doc, what caused the heart attack? Was it diabetes or eating Twinkies all day or no exercise or my wife nagging me constantly? The doc is going to say probably all of the above. So if we mitigate all those risk factors, and even if we have a 5% improvement with each of those risk factors mitigated, we can have an over 80 to 100% success rate. It just makes biological sense. This is not rocket science, Peter. This is simple. This is good medicine. And this is something anybody can work toward if they equip themselves with the knowledge, because as the saying goes, we're flooded with information, but thirsting for wisdom. Equip yourself with the knowledge, advocate for yourself, seek help through appropriate channels, and you can work toward building your brain health. And there's so many great free resources out there, like Dr. Amen's podcast, The Brain Warrior's Way, numerous books that he has, Dr. Mark Hyman, James Greenblatt, Joe Pizzorno, really prominent doctors who are really moving the conversation forward in the whole integrative of functional brain health approach. And my role is to bring to the world what we can do with an integrative approach to sleep, rather than here's some Ambien, here's some Trazodone, here's some Klonopin, which can lead to dementia and long-term studies.
In conclusion, take care of your brain, take care of your body. It produces everything that you need to be happy, joyous, and free. Sleep is important, very, very, very important. Let your kids sleep late, the 12, 14 hours a day. Let your teenagers sleep late. My father used to hate me sleeping late. And I understand. I mean, my father was an orphan at the age of 13. And so he learned survival skills, and he saw somebody that slept late. And many parents still do, is being lazy. No, it's part of what we need. Our body commands it. Our body demands it. Dr. Creado, what would be some closing words for our community?
let's remember to be process-oriented, not outcome-oriented. Take care of ourselves first, and then take care of our communities. Remember, there are things beyond our control that we cannot possibly hope to change. Focus on what's within our control. Spread the word, spread awareness, care about one another. Focus on the process, not the outcomes. And just follow your heart.
Where can people find you?
Well, the Amen Clinics, you can Google Amen Clinics. You can find any one of our clinics across the country. Dr. Amen has an Instagram, doc_Amen. Amen Clinics also is an Instagram. We're in every social media platform. For me, my Instagram is Peak Sleep Performance, named after my book, Peak Sleep Performance, that I published this year. And they can also find me on ShaneCreado.com.
All that information will be available in the show notes. Dr. Shane Creado, thank you. Thank you. Thank you so much for the opportunity to be with us and with our community. Your wisdom and knowledge is much needed, and thank you for the afforded time.
My pleasure. Thank you.
Thanks for joining us today on another episode of the Coming Clean podcast. Make sure to join Peter and his next guest on a brand new episode as we continue changing and impacting lives across the world. Share this episode with a friend, follow, subscribe, and leave a review.
Boy, I had to get it fast. Get a dash in my position, you would never last.